This is the video for Tracheostomy Care. Verify the healthcare provider's orders.
I've checked the orders and I had to provide trach care suctioning and the care of the site for this patient.
Gather the necessary equipment and supplies.
Suction kit, clean gloves, disposable inner cannula if that is the case, new ties. I have a kit, I have a spare pair of sterile gloves, and I have goggles for eye protection.
Introduce self to the patient and family and perform hand hygiene.
Hello, Miss Cruiser. My name is Christy, and I will be your nurse today. I have to suction your trach. I see you have some secretions, and I also have to provide care to the site around your tracheostomy and put a new dressing on.
Okay. Identify the patient using two identifiers. Compare the identifiers in the patient's MAR or medical record with the information on the patient's identification bracelet.
I would have some form of identification at hand. Miss Cruiser, could you please state your name?
Donna Cruiser,
And could I also have your date of birth, please?
June 24th, 1965.
I've checked that against my MAR or physician's order or something on the electronic health record. I've also verified that her medical record number matches.
Apply pulse oximeter to the patient's finger.
Ms. Cruiser has her pulse ox on right now.
If oxygen delivery is needed, make sure that the oxygen and humidification delivery sources are in place and that they have been set to the correct levels.
Ms. Cruiser currently has what's called a trach collar that delivers humidified oxygen for the patient, and that is her oxygen source.
Prepare the equipment on the bedside table.
I've cleaned my bedside table. It's at a proper working height. Suction kit is prepared, and I have all my other items here as well.
To look for excessive peristomal secretions, apply clean gloves and face shield if needed. Examine the tracheostomy site for soiled or damp dressings.
Ms. Cruiser, I'm going to take off your dressing, and I'm going to take a look at the skin around your site. I'm also going to take off this trach collar. Normally you would be able to unsnap your trach collar, but this particular trach collar does not have a snap. So I'm just going to go up over her head for today. And I see you have a little bit of secretions on here, Miss Cruiser. And I've checked the dressing. The secretions are a clear, thick consistency, and the skin around her stoma is slightly red, and it's all intact. All in all, it looks pretty good.
At this point, you would apply sterile gloves for suctioning and suction the patient, keeping your dominant hand sterile throughout the procedure. To view how to suction a tracheostomy, you can watch the video titled Nasal Tracheal and Nasal Pharyngeal Suctioning. We will continue with changing of the tracheostomy dressing and inner cannula. If the patient had a disposable inner cannula, open this package next.
Okay, for this I have the new inner cannula, which is disposable, and it's recognized by the acronym DIC with the size of the tracheostomy tube, which this one for our mannequins happens to be a number 4. Just like with all things that you open away from you first. Okay.
Open the sterile tracheostomy kit.
Some facilities use a commercialized tracheostomy kit. Others do it by a la carte, where they just get all the items that they feel they'll need for this procedure. Today I will use this prepackaged kit. just gonna open this up in case I might need it as a garbage bag. It's not very big, but I have it here just in case. Oops, Cruiser, I'm gonna put your side rail down also. Okay, now this particular prepackaged kit doesn't open in the traditional manner. It has a first flap that you open away, but then it has a next flap that opens towards you. So just follow that direction. And then you'll have to open the next flap, which in this case happens to be your right flap, and then the left flap. And with all new kits, the paper's pretty stiff, so you just have to kind of be careful how it all pops open. Sometimes it's a little bit of a challenge.
Pour about 0.5 to 2 centimeters of normal saline into the sterile basin. Follow your facility's policy on the use of half-strength peroxide for cleaning tracheostomy inner cannulas.
Okay, so I have my normal saline here. I would make sure I have the correct solution. I would check the expiration date on this. If it has been previously opened, I would make sure it's been within 24 hours. If I'm opening it and it's brand new, then I need to put the date, time, and my initials on that container. Before I pour it, I have to do a couple things in relation to this kit. The first thing on top of this kit are sterile gloves. I'm going to put on the first sterile glove so that I can set up my field. Sometimes it's easy, sometimes it's not. I'm going to put this on my dominant hand. Now, normally you could open this cap ahead of time. If you find yourself in a little bit of a pickle and you've got one sterile hand, you can tuck it under your arm, open up the bottle, and have your bottle prepared, if not prepared ahead of time. Now that I have a sterile hand, I'm going to kind of parcel out all the objects onto my sterile field, just like you do with any sterile field. This particular kit has a sequence of little basins. They're kind of like little Russian nesting dolls. And you just have to kind of parcel them out. There are two larger ones. You may need all of them, you may not, just depends on your institution, the policy, how they go about all this. If you can't get them apart, you can just stick your hand in here and pick it up and move it over. Now this does not have to be sterile on the outside, just the inside where I'm pouring the solution. So I'm going to pour my solution, and this is normal saline. For today we are pretending. Okay.
If the patient was on an oxygen device, hyperoxygenate the patient.
You can either take the patient's trach collar, place it over the patient's tracheostomy tube, and have them take several deep breaths. If you are in a position where you need to provide oxygen to your patient, you can use an ambu bag. This little piece here fits over the tracheostomy tube. And you kind of palm it like a basketball. When they inhale, you squeeze the bag. When they exhale, you release. You do this about 2 or 3 times. I've lost my connection. Make sure you keep that on there. Don't be rough though, because if it's a new tracheostomy tube, it can be a little bit sensitive. while I'm doing this, I'm also watching the pulse ox to make sure her O2 sat is sufficient. Okay. And take that off and you set that nearby.
Continue applying sterile gloves.
Okay, so my second sterile glove is here on the field. I'm gonna grab that. Of course, it's all twisted around. Alright, so I have my sterile gloves applied.
Remove the new cannula from the packaging.
Okay, so I have the new cannula. I'm gonna grab that with my dominant hand. Okay.
While touching only the outside of the tube, withdraw the inner cannula and inspect it for secretions. Dispose of the contaminated cannula in the appropriate receptacle.
Okay, so I'm going to use my non-dominant hand for this. And this particular inner cannula, you pinch it like a clothespin or like a chip clip. There are others that have little rings almost like the containers, like in an orange juice container. This one you just pinch and you remove it. And I'm going to take a look to see what the secretions look like, if there are any. I'm going to use my little disposable bag that I have right here to throw that away.
Place the new inner cannula and lock it into position. If necessary, reconnect the patient to the ventilator or other oxygen source.
Okay, so I start mine sideways. And as I insert it, I twist it around and it should slide in pretty easily. And then I pinch it into place and I make sure it's secure.
If you have a patient with a non-disposable inner cannula, you will follow these directions.
Okay.
Use the non-dominant hand to unlock and remove the inner cannula. Using strict aseptic technique, touch only the outside of the cannula. Drop the inner cannula into the basin of normal saline.
Okay, so what I'm going to do for this, this is my normal saline I prepared earlier. So I'm going to use my non-dominant hand. I'm going to pinch. I'm going to drop that into that saline.
If necessary, replace the tracheostomy collar, T-tube, or ventilator oxygen source over the outer cannula.
If that were the case, I could put Miss Cruiser's trach collar back over that opening and have her take some deep breaths.
Quickly pick up the inner cannula and use a sterile brush to remove secretions from inside and outside the inner cannula.
Okay, so this particular commercial kit comes with a pair of forceps. I have to do this kind of one-handed because this hand is the hand I used for removing the inner. It comes with some pipe cleaners. And then it has like a little tiny bottle brush that you can use for that. I'm going to pick up the inner cannula just by the outer portion of it, like I took it out. I'm going to stick the little bottle brush in. Keep it kind of low to your basin, otherwise it splats all over. Okay, I've completed the cleaning of the inner cannula.
Hold the inner cannula over the basin and rinse it with normal saline, using non-dominant hand to pour the normal saline.
Okay, so we're going to switch things up just momentarily. Since this is my sterile hand, and this part that goes into the patient's tracheostomy tube is considered sterile, I'm going to grab there. With my non-sterile hand, since the bottle is not considered sterile, I'm going to pick it up. I'm going to pour the solution over that inner cannula to rinse it off.
Replace the inner cannula and secure the locking mechanism. If necessary, reapply oxygen if needed and hyperoxygenate the patient.
Okay, so here's my dirty non-dominant hand. I'm going to take Mrs. Cruiser's trach collar away momentarily. And since this part is considered dirty, I'm going to grab it by this part right here and insert it into Miss Cruiser's outer cannula. Miss cruiser, I'm gonna put this back in. Okay, and it's pinched into place.
The next steps will be to clean around the tracheostomy. We already removed the drainage sponge earlier in the procedure to look at these secretions. Use a cotton-tipped swab and 4x4-inch gauze saturated with normal saline to clean the exposed surfaces of the outer cannula and the stoma under the faceplate, extending 5 to 10 centimeters in all directions from the stoma. Clean in a circular pattern around the tracheostomy from the stoma site outward.
Okay, so that means I need a new basin for additional saline, because this one is considered dirty since I've cleaned the inner cannula. I have one sterile hand, one non-sterile hand. So what I can do is take out these items I'm not currently using. I'm gonna stick my hand in here, bring it over. And still with my dirty hand, I can pour some additional saline into a new basin that is still sterile. Included in this kit are some twill tape ties, which you can use instead of commercial ties, some gauze, a new drainage sponge, and 3 Q-tips. Those Q-tips go into your new saline. Now, patients that have tracheostomy tubes sometimes don't have the capability to either flex or hyperextend their neck, so you do the best you can to clean around the stoma. If need be, if you think you don't want to touch that, you can take a gauze from the kit. If not, I'm just going to gently move this part of the tracheostomy tube, this flange, because it rotates or pivots. I usually clean in one stroke, usually 3 to 9 if you're looking at the hands of a clock, or 12 to 6 depending on how you can get in there. This is dirty, so I'm going to throw that away. And I'm going to clean this side. Basically what you want to do is get rid of any secretions or crust. Sometimes 3 Q-tips is not sufficient, so you may need to bring extra. Okay, so I've cleaned the stoma.
Using a dry 4x4-inch gauze, pat the skin lightly as well as the exposed surfaces of the outer cannula.
Okay, so I still have remaining in my kit, and this hand is sterile. Some 4x4s. And I kind of gather it by the corners, so they look kind of like little wontons. And then what I do, you can usually get kind of a 2-for-1 out of this. One side can dry the stoma skin, the other side kind of grabs the top part of the flange. Okay, so I've dried that off.
Apply a new drainage sponge.
Okay. So here's my new drainage sponge. Kind of looks like SpongeBob's pants. So what you do, at this point you don't have to really be sterile, but more clean. So I grab the little pant legs and fold them up. And then I pinch them. Right at the seam. And all you do is kind of tuck it under the flange and then pull the little pant legs or cut parts of the drainage sponge. And I get out all the wrinkles as best I can so we don't get any more skin breakdown.
Secure the tracheostomy using the tracheostomy tube holder method. Maintain a secure hold on the tracheostomy tube. Align the strap under the patient's neck. Make sure that the Velcro attachments are on either side of the tracheostomy tube.
Generally, you get assistance with this particular part of the skill, but you don't usually want to take off one trach tie until the other one is in place because the patient can cough and dislodge it. So for this, you can either use the prepackaged twill tape, or what many hospitals now use are the prepackaged Velcro disposables, which are quite nice. Today, I'm going to show you how to use the prepackaged Velcro. In this case, since I'm alone, I'm going to first put on the new one and secure it to the side farthest away from me. If you're not sure how this goes, the Posey label, which is the name brand of this particular product, goes facing outward. Ms. Cruiser, could you please lift up your head? I will have to reach across to you for a minute. I apologize. This is why we wear goggles in case she coughs. Okay, so what I do is I slip the first strand through. Hang on, Mrs. Cruiser. I think our securing device is all twisted. So pull that up and through. And this is always a little bit of a challenge. It's a lot easier if you can get someone to help you so they can hold the plate in place for you. So it's okay, don't ever have that luxury. Get in here with her, Miss Cruiser. Okay. So I'm going to secure that one first. Now that I have a hold of this new one, I'm going to loosen up the Velcro of the old one. Miss Cruiser, we have a lot of Velcro going on here. Put the strand of the last tie up and through. And secure that. Take Miss Cruiser's old one off. Dispose of the old one, and I want to make sure that her new one is on securely. Usually want to be able to get 2 fingers in between the new trach collar securement device and the patient. This one happens to be, I think, a little big for her, so I probably will maybe get a little bit smaller one for her. Can get 2 fingers in here. Okay.
Position the patient comfortably and assess his or her respiratory status.
Okay. I'm going to replace her trach collar because that's her oxygen source. Also provide some humidification if she has really thick secretions.
Remove gloves and face shield and discard them in the appropriate receptacles. Replace cap on the bottle of normal saline. Date the container and store this and other reusable liquids in an appropriate area. Help the patient into a comfortable position. Place the call button and other items within easy reach.
Ms. Cruiser, here's your call light. Are you comfortable at this position?
Yes, I am. Dispose of used supplies and equipment. Leave the patient's room tidy. Remove and dispose of gloves and perform hand hygiene.
So put on another pair of clean gloves just to clean up all this mess. Dispose of all that.
Document and report the patient's response and expected or unexpected outcomes.